Hello and welcome to this broadcast. This is Sharon Blondheim. I'm here to talk about my MSN evidence-based educational project, which is patients aged 18 through 65 with type 2 diabetes and non-compliant with their diabetic diet. Here we see the goal of this presentation is giving insight to patients 18 to 65 with type 2 diabetes who are non-compliant with their diabetic diets. The population of focus is patients aged 18 to 65. Here at the introduction, you see the My Plate from the ADA.com. It shows the plate that is cut into thirds, the big half on the left. The green part shows non-starchy vegetables such as broccoli. The upper right, the orange part, is potatoes and pears, which is carbohydrate foods, and then the bottom are protein foods. And then look to your right again. To the right is the turquoise water or 0-calorie drink, which is a free drink, no calories. My background comes from Stanhope in Lancaster 2020 in Nursing Policy and Ethical Influences. These four are prevention of adverse outcomes, promoting community and public health, prioritizing programs and public health policies for the community, and then lastly, advancing public health. Background continues, gets into the statistics. The global prevalence of type 2 age 20 to 70 is 462 million, that in the United States 30 million adults 20 to 24 are already diabetic. That's a pretty big number. Background continuing from the U.S., Alabama, and locally is 593,500 adults in Alabama have diabetes. That's 14.9%. In Montgomery, there's 19%. This is a typo, and the next one is supposed to be 14.9 are diabetics. And then Caucasians, 17.3%. In South Alabama, 16.4%, and then 12.2% in the Northeast District, and that comes from the Alabama Department of Public Health. Reviewing the literature now, Article 1 from Burrell and Company 2022 suggests that diet adherence is also associated, or non-adherence is associated with elevated hemoglobin A1C levels, and then the risk factors at the bottom from Burrell et al. is also showing. This is from a level 4 case control or cohort study. Article 2 from Bumparati et al. 2024 is a level 7 expert opinion or consensus statement that talks about effective management beginning with patient education, and that is a big one, into medications and also diet management that helps patients control their blood sugars. Article number 3 is from Tang and Yang 2025. I also added some, I mentioned it later, Wilson et al. 2024. These are level 4 case control cohort studies, but this article from Tang and Yang does talk about the Chinese adults having type 2. There's 46% of Chinese that have that due to their poor diet compliance. However, they do have strong family support, urban residents, and do have some knowledge of diabetes-related nutrition to help their compliance. CAC and MAC, article number 4, talks about the patients and individuals in Turkey do have the same problems of non-compliant diets due to finances, fatigue, and limited time to spend on it. This is a level 5 qualitative study. My last article here is from Wilson et al. That I mentioned before. It's from 2024, is a level 4 case control or cohort study. Echoes the key predictors of poor diet adherence. You see the My Plate there on the left. That's repeated from the introduction, but it also echoes here that limited knowledge, low health literacy, which deals with education, financial constraints, and then lack of dietary guidelines. So that's why I added in the My Plate there. So this is the beginning of the first of the three needs assessment, the gap analysis that shows that the state of needs are patients 18 to 65 that are at risk of developing type 2 diabetes due to a non-adherent or non-compliance of their diet. The desired state is to prevent this progression. The identified gap is that patients are progressing from pre-diabetic to type 2s. Gap due to knowledge, skill, and or practice is mainly knowledge, beginning because they don't have exposure to the facts related to type 2 development, and then the skills and practice go hand in hand with that. They're not given prevention strategies in the basic part, which is diet changes, behavioral modification, and then use of medication management to prevent type 2. The methods used to identify the professional practice gap, again, echoes back these needs assessment results. As 25% of the patients at the clinic do have low diet adherence, and that's from the Alabama Department of Public Health 2020. The second part of the needs assessment was a SWOT analysis, which is the strengths, weaknesses, opportunities, and threats. The strengths here that I showed was I'm a full-time employee at Jackson Hospital, doing my practicum at the clinic. I do advocate for patients, residents, and physicians, giving continuity of care at both places, and support the residents and staff in teaching skills and in their supervision of the patients. Weaknesses is that there's a high staff to patient ratio at the clinic, anywhere from 20 to 50 patients seen per day. There are myself, the manager, and then a medical assistant, and then the physician to resident ratio as low as 1 to 5 or 6. The opportunities there are for a senior type 2 nurse educator due to the volume of patients. And the hospital does have a BSN certified educator, but no senior level advanced practice educator there. And I slipped in the fact again from the CDC 2021 that it's still showing there's an increase in pre-diabetic and type 2 diabetes cases in Alabama. The threats are in the paper and in the news. WSFA here's local station, but Jackson Hospital has filed for Chapter 11 bankruptcy. It's been all over the news. The inpatient admissions at the hospital have dropped to less than half. However, the ones at the clinic we're still booming over there. And then the need for diabetic education has not changed, even though finances and otherwise. My last part of the needs assessment was the windshield survey that shows the area that I drive through there just about every day, seems like. The homes are built from 1940 to 1975 without sidewalks. There is a park, which is a public place there. It's been maintained, but there's some green space. Culture and services, there's no local libraries or theaters. We are the civil rights megadome, I guess you could say, and they have buses and different venues there to take people around. There's scattered food banks, mental health, and welfare centers locally. The education and demographics, the schools are in disrepair. They're trying to rebuild. There's colleges present. There's Alabama State, Troy Montgomery, and Auburn Montgomery. Transportation and safety, I did mention the Montgomery buses transport with limited hours. There's no bike lanes. There are broken street lights, and the fire and police station is nearby too. Continuing on, I did do a key leader and informant interview on July the 3rd with 2 people, one from the Alabama Diabetes Association that serves the north region of the state, and she sees the problems with diabetes as a patient's problems, and they can get access if they need to. And then an interviewee from the clinic did realize that the patients don't have the best finances and they probably don't choose to eat the right things, but she hopes for the best outcome for the patients. My theoretical framework comes from Orum's self-care theory with relationship concepts from Gonzalo that writes that the theory states that maintaining life, health, and well-being requires helping patients to develop their capacity for self-care. And this theory also focuses on self-care, focused treatment plans, and developmental care. My favorite one is the theoretical framework borrowed from Maslow's hierarchy that applies to my population of interest from Howell et al. 2023. And it shows the pyramid here that we've all learned, but different areas apply to people. People are in different parts here, and that doesn't make them any different. We all need to try and get them to the pinnacle, which is self-actualization, and help them to develop and become more successful in their treatment. Here, the environmental, individual, and agent factors are listed from several different references that I have here. They are socioeconomic, psychological, financial, educational, and genetic. The socioeconomic is the neighborhood. Psychological, some parts of this are dealing with their type 2 diabetes. Finances is the cost and continued care. Education is just learning different parts of diabetes and keeping up with what you need to as far as medications and treatment. Primary, secondary, and tertiary treatments come from Stanhope and Lancaster 2022 for the primary prevention for the behaviors and diet choices, secondary adherence and accountability, and then tertiary is bringing it all together. Evidence-based education project plans shows the nursing diagnosis. There are 3 here, and then bringing them all together into the education piece to help the patients learn and be at their maximum capacity. The priority community diagnosis is ineffective medical care related to their non-adherent diet, evidenced by elevated hemoglobin levels, limited diet knowledge, and then environmental and social barriers to healthy eating because of the area they're in. Evidence-based education plan, mine deals with the personal, interpersonal, and social system of the population and how they are dealing with their disease at a home-based level with their care and then within themselves, and then the way that the advanced population health nurse can help by Healthy People 2030 is being the care coordinator, educator, advocate, researcher, and the clinical nurse specialist for the patients. Here is my evidence-based education project plan, measurable plan objectives to deliver care diversely, to teach and treat with protocols at the clinic, investigate the resources, develop a pamphlet, implement the project with treatment, assess the protocols at the clinic, utilize the sub-roles of the advanced population health nurse, examine the trends and issues, examine education of the diet habits, and then educate them on everything. Here we see that my plan was launched in September. I had 3 different classes, and the evidence-based project was the barriers and the challenges here. And then the project was implemented for 2 classes and then 1 at the library. These are the handouts that were at the clinic, the health monitor and the blood sugar diary, and then the one on the upper and the right are the ones that I handed out for the risk and the education. My reflection is here. There needs to be more classes, post flyers, help them with the diets. My objectives were achieved. The plan was carried out. There were barriers, and I recommend that it be held at least monthly and bring in resources. Thank you to the staff and the people at the hospital and the clinic. These are my references. Thank you very, very Bye.